My name is Jesse, and this is injection via the IM intramuscular. I have my MAR for Miss Mary Smith. I'm going to come to my cart. I will perform hand hygiene. I will set up my equipment, and today Miss Smith will be getting 20 milligrams of LASIK via the IM. Today, the amount, the type, and the route, and the patient are all confirmed. I have my equipment. I have 3 milliliter syringe. Because of the LASIKs, it's 10 milligrams per milliliter. We will be pulling up 2 milliliters of that. I also have my 22 gauge 1.5 inch needle. I will open up my syringe away from me. Pull out, discard, set that down. I will open up my needle away from me. Using the lure lock method, I will insert the needle into the syringe. Discard. I will then set my needle down. I will alcohol swipe my LASIK container to get rid of any bacteria or microbes that may be on top. I will then uncap, and seeing as how I am pulling out 2 mLs, I will draw up 2 mLs of air into my syringe without touching the stem of the plunger. I will insert, push in the 2 mLs, grab the bottle using my thumb and ring finger. I will then draw up my 2 mLs of LASIKs. I will then knock any air bubbles that may be in there. I will then push up if I overdrew to get the air out, but I am still at 2 mLs. I will do the swoop and cap method. I will again check my MAR, 2 mLs, 10 milligrams per ml. We want 28 milligrams. That is right. I will then grab my alcohol swipe, grab my MAR. I will come to the patient's room. I will knock and introduce myself. Ms. Smith, my name is Jesse. I will be your third nurse. I will then perform hand hygiene. I will ask Ms. Smith for her birth date, and as she gives me her birth date, I will look at her bracelet. Ms. Mary Smith and her birth date. She has no known allergies to LASIKs. Ms. Smith, I am here to give you your injection of LASIKs. It's to help your urinary output. I will raise the patient up to the height that is comfortable for myself. I will then lower the bed rail. I will also close the curtain for privacy. I will remove the blanket to find my location, which I'm going to use the ventral gluteal area, and seeing as how we can't really inject the patient, I'm using the pad. I will put on my gloves. Also put my stand at a working condition. I will first find my location. Hand on the greater trochanter, the palm. My pointer finger at the anterior superior iliac spine. My middle finger at the iliac crest. And I'm going to do my injection in this area. So now that I found it, I'm going to alcohol swab that area in a circular fashion, going from inside to out. I will let that dry without blowing on it. I will then uncap my needle, throw it in the sharps container. I will find my spot. I will Z-track. I will inject in a dart-like motion. Use my finger and thumb to hold, keeping the Z-track. Pull up, holding that Z-track, let go, throw the needle away in the sharps container, which I will not do because we will need to reuse it. I will then recover the patient after removing my gloves and throwing them away. Cover my patient, lift the bed rail, and then put the patient back in a comfortable position that Ms. Smith wants to be in, which she wants to be all the way down. I'll then perform hand hygiene, clean up my mess, and document. And that is my IM injection.